Hi, everyone. Dr. Liz here. Welcome to the Hypnotize Me podcast. I'm glad you're here, glad you're listening and learning, and hopefully it will help you with your journey along the way. I am a psychotherapist with a specialty in anxiety, insomnia, and deeper emotional healing. Hypnosis is one of the tools in my toolbox that I use to help people feel better and to help people be better. I do work all over the world. Please feel free to reach out and contact me if you would like some help. I've been an entrepreneur for most of my adult life, built an award-winning company, sold it, and then focused mainly on my private practice. That gives you a unique perspective, especially my ability to work with people in business at all kinds of levels. Before I go, if you'd like to support the podcast, you can go and subscribe to the newsletter. And you'll get free hypnosis downloads that you can listen to immediately. Another way is to buy one of the downloads that I have for sale. I only have a couple up there, but they're good ones. They've stood the test of time. Or if you'd like to join my Patreon, that's an additional way to support the podcast. I made the decision to not run ads during my podcast because I really do see it as an act of service. I completely respect people who do have ads on their podcast, but it's just not my path. But a great way to show your own support for it is to join the Patreon. So if you're interested, pop on over there and check it out. All right, everyone, enjoy the episode, and I hope to see you back here soon. Hey everyone, Dr. Liz here. I hope you're doing well. It was like raining here this week in South Florida, to the point that it made the New York Times, like the actual city I live in, Hollywood, Florida, made the New York Times because of the flooding that's going on. We're pretty used to it, actually, but even for us, it was pretty bad. So I've been dealing with that, but it's given me lots of time at home to edit the podcast because you can't go out. Your car may get stranded if you go out. So I've been doing work from home, seeing clients online, even my in-person ones that I normally see. We switched to Zoom. So that's what I've been doing the last couple of days. My interview with Jacquelyn is lovely. So I get all kinds of questions about EMDR versus hypnosis, and she goes into those differences and also talks about her 6-week program that she has for resolving PTSD and complex PTSD. And it sounds really fascinating. She gets some really good results. So if you or someone you know is dealing with that, I would highly suggest listening to this interview or forwarding it to them so that they can get a better understanding of the different modalities that can really help resolve some of that trauma. It's really hard to live with when you're triggered by different things or all the time or unexpectedly. So much compassion for anyone dealing with that. All right, let's jump into it. Peace. Hi, Jacquelyn. Welcome to the Hypnotize Me podcast.
Hi, thank you. Thank you for having me. Thank you.
Why don't you tell the audience a little bit about who you are and your background?
Okay. My name is Jacquelyn Haley, and I'm classed as a clinical hypnotherapist. And I'm from a place called Swansea in South Wales, the UK. I've been a practicing hypnotherapist for, I believe it's 16 years now, so quite some time.
Yes.
In that time, I have worked in renting clinic space. I have had my own offices. I've run my own wellbeing centres. I've worked from home. I've worked online. And at the minute, I'm working for a group of businesses. I have an office that I rent, and we share, myself and a counsellor have a little business together. And I've been there since kind of February time, and it's absolutely beautiful. I love it there. It's right in the city centre, perfect car parking, views across the city. So I absolutely love going to It's amazing that. So yes.
Yeah, fantastic. The view from the office is important. Like my office, it's on the 4th floor of a building, so it looks out over the tops of trees, which I love.
Lovely. Mine looks over the sea, the bay.
Ooh.
and it's kind of close to the coast. So even though you got that kind of city vibe,
Uh-huh.
beyond that is this beautiful view with little mountains in the background. So it's just so lovely. It makes such a difference, doesn't it, when you
It
walk
does.
into work?
Yeah, it
Definitely.
does. I was looking for a new office recently, and she's like, "Oh, it has a window," and I go and look at it, and it looked out over like the parking, like his first floor, and it looked out over cars coming in and out, and I'm like, "No." Like, thank God for a window, but no, not this one. So it does affect you, I think. As a therapist, you're there a lot. So
Yeah.
yeah, it does. And it's nice for the client too to come in and have a really nice view, I believe.
Mm.
Yeah. So how did you first get into being a clinical hypnotherapist?
Um, it was due to my sister. My sister at the time, she was 35 years of age and she got diagnosed with bowel cancer.
Mm.
And it was such a shock to the family.
Mhm.
And I always thought that one day I would like to have been a doctor in psychology, but not in medicine.
Mhm.
And I thought, well, I haven't got the time to do it because I was literally pregnant, 7 months pregnant, and I already had a 3 month baby.
Wow.
I had my children within a year of each other, and
Oh.
I thought, what can I do differently? And this hypnotherapy catalogue fell through my front door.
Mhm.
And the guy that was teaching was actually based in a cancer hospice in South
Mm.
Wales. So his background was in cancer care. I was like, how perfect can this
Yes.
be? And let's take it back a little bit to my hypnosis journey. Prior to this life, I used to work in travel and I was based overseas in the Canary Islands, and I was a resort team leader for a big holiday company. So my job was to deal with the more serious things in resort. And I'm talking about, sadly, accidents and
Mm.
multiple people involved, deaths overseas, everything, and that was my job. But I was gaining weight quickly because we ate in 5-star hotels and the life was partying, and it was just a
Mhm.
lovely lifestyle. And I was putting all this weight on, and one of my guests said, "Try Paul McKenna, his weight loss program." And I did, and within kind of days, I can always remember his voice, "You will take regular motivated exercise." And the next thing, I'm running along the beach. I lost a stone in a month, but my head was more clearer and I was able to do my job a lot better. So
Mm.
it did so much for me.
Yeah.
So yeah, when I come back to the UK, then this is why we originally got into it. But then it was my sister. So I wanted to kind of do something more for her. And that's why I did go into it eventually.
Got
But
it.
what I realised in my journey working, obviously, I went into cancer care. I did a degree in complementary medicine,
Mm.
and my placement was in a cancer hospice then.
Okay.
And what I realised during that time was that everybody that come to me with a cancer diagnosis had this immense history of trauma.
Mm.
It never come without that.
Mhm.
And I understand life is traumatic for many people. We all have a story to tell when we get to a certain age, but this was just over and over. And then I thought, hang on, I need to look at more preventative health,
Uh,
look more down that route. And that's why I just went into kind of mainstream hypnotherapy. And when I say mainstream, I mean dealing with general conditions, almost like clearing it before it
oh yeah.
got too big. And then eventually over the years, after niching in fertility and other stuff, I now work in anxiety and trauma
Okay.
because I realised if it's cleared that area, and for your listeners, I'm not sure what you all think on mind, the psychosomatic, the mind, the effect of the mind and the body. For me now, it's everything when I deal with people is an underlying trauma or anxiety that they've not recognised or come to terms with or overcome.
Mm.
So
Mhm.
that's what I
Yeah.
see.
I mean, I think these days it's pretty much undebatable that there's a mind-body connection. The somatic and the
Mm,
mental and the emotional are all very connected. Yes. So
no.
then you became interested in EMDR at some point.
I did, and again, it with EDMR. I never, when I first trained in it, it was when COVID broke out.
Okay.
And I don't know what it was like in America, but here, a lot of the hospitals were like closed in. And so the nurses and doctors were in work and they weren't allowed to go home.
Oh,
So
wow.
that was such a frightening time for our medical staff.
Yes.
And one of our fellow hypnotherapists is a doctor, but he was a doctor in the military. And he got a gang together quite quickly.
Uh-huh.
And and he trained us EDMR online.
Oh,
So we were
interesting.
able to work with the promise that after we finished, we would go face to face to learning it,
Okay.
And I wasn't really struck in it. If I'm honest, I wasn't really struck in it. I had trained in another one called IEMT. I'm
Mhm.
not sure if you've heard of that. But it's when I went through my own personal trauma. Myself and my husband split up after 21 years, and it was a struggle in the early days.
Mhm.
So I did this diploma online, and a lot of the work there was looking at Dr. Jamie Mayrock and the way she works. And I don't know if you've ever seen her work, but oh my goodness, watching her was like silk. I can only describe it as like silk because she has such a beautiful way about her. She's so calming, she's so compassionate.
Uh-huh.
And I do believe she's now I can't get the words out. Shapiro's she's kind of taken over a role in the EDMR world, but
Mhm.
she was just wonderful to watch. And I think it changed my way about it. But after that diploma, we had to self-administer, and for 2 hours. We
Okay.
were sent the music, and like I said, it was during lockdown. We
Uh-huh.
had this screen we had to watch back and forth. And I come down here, we're in my kitchen there, and I was washing my dishes. It was about 11 o'clock in the night time, and I just felt a smile in my heart. That's the only way I can describe it.
Mhm.
And all this kind of fear and anger I had towards it just all went. It
Wow.
just all went away. And it was like,
Yeah.
wow, this is amazing,
Uh-huh.
So then I went to train with it in person to integrate it into hypnotherapy. And I will give this man a lovely shout out. His name is John Dewar in the UK. He's a real old school hypnotherapist.
Mhm.
And it was just lovely. And I got a few friends in the hypnotic world, and we all kind of met up for a weekend, and we
Mhm.
trained in integrating into hypnotherapy, which is absolutely lovely as well. So,
Okay,
yeah.
fascinating. So I know most people are probably not familiar with the IEMT, and I only just heard about it recently myself. So can you tell us the difference? Tell us what it stands for, and then the difference between IEMT and EMDR.
Integral eye movement therapy.
Okay.
Now, in my opinion, the movements are the same. We
Uh-huh.
do the eye back and forth
Okay.
that way. We do like a figure eight one in it. The
Okay.
difference with
Just for
IEMT is
the
before.
just for the
Sorry,
listeners, Jacqueline's
sorry.
like making this movement with their hands, and I know you can't see that. So, EMDR, you're often following the therapist's hands, or some of them have a light bar where you follow a light back and forth. So, she's making the IEMT, you're saying a figure eight. Do you do
Figure
that?
eight, like an affinity symbol. So you
Infinity
make it
symbol. Oh,
that
so
way.
sideways. Oh, and horizontal and
Yeah.
vertical. Okay.
And
And
they look at targeting the memory or the emotion attached to the memory,
mhm,
different ways to use it, or mainly to do with the emotions. And what I liked about IEMT was that before clients would come, they would be asked to write a statement about their presenting problem.
okay.
And we would look at that statement to see the amount of I's they use, the U's they use, the
Mhm.
we, like, you would have thought I would have been over that by now, the way they spoke. So we
Yeah.
look at that, and you go into it saying, well, how old was that I at that time?
Mm.
And it really gets you to
Oh.
think. I mean, when I trained in this, my tutor, it was really weird. And very quickly, I went
Uh-huh.
back to a time in my life when I was 10 years of age.
Uh-huh.
And it was all to do with a personal thing in my life, as it always is, to do with my mum. And it was like, oh, wow, the penny dropped, Yeah, and it was like,
Yeah.
wow. So I didn't continue with that. With EDMR, people are attracted more to it because in the UK, it's advocated by our National Health Services.
Okay.
So if we say IEMT, people don't know what that is.
Uh-huh.
They don't really know what it is. And it's right. It was developed by a guy called Andrew Austin.
So wait a minute.
Um,
They know what EMDR is, but not IEMT, or the reverse in the
IEMT, yeah, not,
UK.
not not so much in the UK. In the therapy
Okay.
world, like
Uh-huh.
for example, I did put something in one of our groups this morning saying, I'm doing this podcast. What are your thoughts on it? And they've all come back with alternatives that they prefer, but they're not really well known.
Oh, interesting, huh?
Yeah, they're not very well
So I
known.
think
So,
EMDR in the US is very well known. I do get calls for it, and sometimes people are attracted to hypnosis over EMDR. Sometimes I refer them for EMDR because I feel like it really just intuitively it seems to be a better fit for them than
yeah.
hypnosis. But I don't even have any real I don't know what I would call it, like scientific criteria that I'm using. It's more like a gut feeling that I have. Like, no, I think you should call so and so because she does EMDR. It seems like maybe that would be a better fit.
Mm,
My own therapist did EMDR with me at one point, and I did find it helpful. It took away the intensity of
mm,
this traumatic memory. And actually, I could tell the story very humorously if I wanted to, And so I
yeah.
asked her, like, is it gonna take away my ability to do that as well? And she's like,
Mm.
no, no, no. Like, it's just gonna take away the negative intensity of
Yeah,
what
'cause it's that
happened. Hmm.
that way we feel stuck in that memory where we can't talk about it. We're still feeling
Yeah.
those feelings, and then when it's processed, it's like, oh, it's got like my. I can use myself, you know. Oh, my heart is full of joy now. Joy I didn't realize that it hadn't been.
Uh-huh.
And there's been intense anger. There was a lot behind the story. There'd been a lot of anger there as well, and it was
Yeah,
like,
yeah.
oh wow, I feel back to me again. It was also
Yes.
that la 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 moment. It's like the world's suddenly a beautiful place again, and it was really that's how I felt with it. And I was like, oh wow,
Okay.
maybe I need to explore this a lot more. Do you know, which is what I
Yes.
did.
I mean, do you see a big difference between the IEMT and the EMDR? Is it, or they seem to be very similar in what I know about it now? Almost identical.
For me, are
Uh-huh.
exactly the same, in
Okay.
my opinion. And when we look back towards these I moments, they very much come from NLP anyway.
Uh-huh.
When we really trace it back, you know, and it was just the way it was worded. The pre-work before was a lot differently, and how it runs during the therapy. But when I talked with a
Oh,
therapist about it, you know, the more experience we get, it has to be tailored to the individual
yes.
anyway.
Yes.
So you kind of work in line with that. And when you are working with someone, we're not saying, right, this is what I'm going to use, is tunnel vision.
Uh-huh.
It will go off. It will go off because no, as I said, no size fits all. So you do have to then kind of work around that client to get the best result for them.
Yes. Okay. So the IEMT is
Yeah.
doing a different type of history is what I'm hearing. Like when someone's coming in, you're looking at the phrases and the thing that they
Yeah.
wrote that they want to work on, and how old is that person who wrote that,
Yeah.
versus I've never heard of that for EMDR. It's really just like think of that memory.
And I don't use it either. Very much.
Mhm.
I'll give you an example. I was working with somebody this week online with it. I don't like to do EDMR online, even though we've had the training in it. I prefer face to face with it.
Uh-huh.
But this person was online, and again, a big background story, which I won't go into. But after that hour, you could see how calm their face had become, how centered, and seeing things from a completely different point of view without me having to ask them to.
Okay.
Do you know? So I'm talking in the they them because I don't want to give too much away. But
Of
it was
course.
almost like completely seeing it in a different perspective,
Yes. Yeah.
which was just absolutely lovely,
Yes. Yeah.
beautiful to see. You know? Yeah.
Yeah. So how do you see the difference between those two techniques and hypnosis?
Hypnosis. It right with hypnosis, I tend to do more advanced work and more. I do done it not all the time with regression,
Mhm.
with my hypnotherapy, but with when I do EDMR, I seal it. So, say for example that this is what the outcome of the session they want. How
Okay.
do you see yourself in the future?
Okay.
So we make notes on the future. Then what are they going to be doing when they get through this?
Mhm.
So the hypnotherapy that I then use is just sealing that and getting them to future pace through visualization.
Ah, okay.
And
So for the audience, the
yeah,
future pacing is when you do see yourself in the future. So often hypnotherapists, myself included, will say, now see yourself 2 weeks from now or 2 months from now, or you pick a time period generally that resonates with the person, that you feel like resonates with the person. And so that's what we call future pacing. Like, all right, let me see the changes that happen that are different. Like if you see yourself 2 weeks from now walking towards yourself, what has changed? That's a common like future pacing kind of technique. So you're
this is
saying you do the IEMT or the EMDR and then use the hypnotic technique of future pacing to. seal that in, seal those changes on. Is that correct?
Yeah. It's almost like meeting with their higher self. And I give them that space to be quiet. I get them to kind of look at this person and create an image because they've told me already what they'll be doing. So I'll get them to really bring that to life. And I do be quiet and I let them spend time with their higher self and I let them talk to their higher self, ask the questions, what they need to do. What I like to do, I say, right, okay, so it's going to be in 28 days and we're going to meet for coffee. We're going to kind of imagine that you're walking in a cafe and you're meeting me for coffee. Are you excited? Has something changed? What are you going to be telling me when you meet me? I leave it to them. And like you were saying, I put this time frame.
Mm-hmm.
I don't usually do that. I kind of leave it up to them. I say you might not consciously be aware, but your very powerful subconscious knows a time frame around this. But I do also use that 28 days as well. I say,
Lovely. I love that.
what are you going to be telling me? How are you feeling as you're telling me? And yeah, I'm going to
Yes.
credit the person I got this from. I did a coaching course with a guy called Paul Mort. He's a UK coach. He's hilarious. He's from Newcastle and he's so funny. And I got that from doing his coaching. So I will credit him with that. And it was, oh my God, yes. How would we feel if I'm going to meet him in a month's time and to say, yeah, Paul, I've ticked these, which I have. I've ticked these off my list and this is great. So yeah.
Yes. Yeah, I love it. I love picturing it that way. Because often when I'm working with someone, we're even before we do the hypnosis, I'm having them make a list of how do you want to be? And
Yeah.
sometimes those are qualities you already have and just want to access more. And sometimes those are
Yeah.
qualities or actions or how you want to be in the future that you feel like, oh, I just want to get there. And so
Yeah.
um, it's perfect to use at the end as well when we're doing future
Yeah.
pacing. It's like, all right, if you can access those qualities and you already have, but I love leaving it up to subconscious mind knows the time frame for that. Mm-hmm.
Yeah. And I think as well, with the beauty of EDMR, it is quite rapid.
Mm-hmm.
You can feel the changes almost instantly.
Mm-hmm.
Whereas when I do hypnosis, my love and passion, first love will always be hypnosis. But when you have hypnotherapy, we never know what's changed until they're in that moment.
Mm-hmm.
And when I work with my clients in my hypnotherapy PTSD program, it's always a 6-week program. And it tickles me every time when they ring me up in the week going, "You won't believe what's happened." And I'm like, "Yeah, I probably will, but tell me." It's almost like they've faced this challenge already, and they know when they're coming to me on the next session, we know where we're going with it. And I
Yeah,
can use EDMR to kind of clear that, look at it from a different perspective, then move on with the rest of the program. So it's just perfect the way the universe comes to us, isn't it, and teaches us when we need it.
it
And
does.
yeah,
Yeah.
and I think because in EDMR they feel that go, and it is almost instant for some people. So when the hypnotherapy comes, they've already believed so much in their own kind of power, and then they believe in you as well, and then so when they do the hypnotherapy, it's the work's more or less done before you kind of sow those seeds as well, and get those visualizations in place. So yeah.
Yeah, a lot of hypnotherapists will say that the work's really done. They're there
Mm,
for you to seal
mm,
it in, right?
yeah,
And I don't know, I don't always think that that's the case. Like some people have
yeah,
not, particularly when we're doing regression, we're going back to old childhood beliefs and we're really
yeah,
trying to
yeah,
heal those and
yeah,
develop some ones that are more beneficial for that client. That doesn't feel like that's done beforehand. It's like actually sometimes it's like I want this and I don't know how to get there.
yeah.
So other times, absolutely, the decision has been made. All I'm doing is helping the subconscious mind get on board with that, or the conscious
Oh,
mind. Really, the
exactly.
subconscious mind's made the decision. I'm helping the conscious mind get on board with
Yeah,
that. Yeah,
yeah,
yeah.
exactly. Yeah, I'm finding the energy to go and go off and do it then, isn't it? I just recently trained as a boxer size coach because I was in a fitness way back as well.
Uh-huh.
And I didn't think I'd be able to do it. I'm 54 years of age now.
Mhm.
I used to teach Zumba years ago. I still love it. And I thought I'd love to do something because I now work with, I say menopausal women, but I say the oasis of change, the transition in our life that we
I
go through,
love
right?
it. Yeah, I love
Yeah.
it.
So I went through a crazy time. I won't even begin to tell you what a time I went through last year. And a lot of women were saying to me in COVID times, oh, I just getting this anger and da, da, da." And I didn't understand it because I wasn't menopausal back then. And I remember saying to one of my ex-clients, I would love to have a 24-hour gym with therapy rooms. When you're in this intense rate, when it comes up, you can just grab some gloves and punch. Can you imagine?
Yeah.
Hi, Jack. I'm right. Come over. But yeah, and so I decided to do boxer size coaching as one of my goals for this year.
Uh-huh.
And the coach I was working with, I went, oh, I'm never going to do it. And this room where I'm in now was actually, for the listeners, I'm in a spare room in my house where I've set up my online business, part of my online business here. And we've all got that junk room. We've all got one at home, haven't we? And it was that room to me.
Mm-hmm.
So we changed it. I have a friend who's a painter and decorator. She did everything for me. And it was to teach online. Because when I did my higher self future pacing,
Uh-huh.
as therapists, we don't always do it to ourselves, do we? Do you know?
Yeah.
I could see this like great big word written on the wall called stretch. STR was and then little successful therapy results. Where's this coming from? She was saying, there's your higher self. What's it showing you? And next thing I had this sassy pants kind of part of me coming through with going, you will be back teaching. You'll be doing it with boxing gloves on. I was like, no, I'm too old. I'm not going to do that. But I actually passed my boxer size instruction course in the beginning of April. So
Awesome. I love it.
so the next thing is to do more advanced training. But I also went back to kickboxing,
Uh-huh.
which I used to do when I was 18. So now I go, it's meant to be 3 times a week, but it's like that energy in there. Somebody's like, I'm not coming till I'm tired. But they go, come on, and it's such a lovely class. So back into doing that kind of thing again. And I'm like, all these like teenage children around me.
Uh-huh.
So it's just been really lovely, but it's yeah. So
Yes.
it's nice to do that side of things when a woman is going through that phase of her life to kind of
Yeah, I mean, like to having a place to express whatever
mm,
she wants to express, but particularly that sense of
yeah.
like
So
rage or anger or yeah. Mm-hmm.
but that's what came out of my future pacing. And I was like, I'm never doing, I'm
Love
never doing
it.
this, doing the work of me. And I was like, I'm never going to do it. Oh my God, what am I thinking? But yeah, here we are. So yeah, living proof,
Yeah. Yeah,
living
it's
proof.
funny. I taught prenatal yoga for
Oh,
20
did
years or
you?
so. 20, yeah,
So,
yoga and prenatal yoga. And then I stopped teaching in like 2018. And
you miss
sometimes
it.
I think about going back and teaching again. But still right now it's like there's this part of me that's like, no, I don't know, not yet, not yet. Right? Like but it would be interesting to do something completely different than that.
Boxer size was fun in terms of learning how to punch, crack, how to move the body. And our coach was he was an ex-military man, and he had all these kind of upbeat rocky songs on, teaching us the group work and a little bit of aerobics, and it was hilarious. We all had such a great time being taught as well. So yeah.
Yeah.
And with the yoga as well, there's I was looking for an instructor that does menopausal type of yoga.
Oh yeah. Hmm.
But it is so much needed for women to bring us into that space. And during pregnancy, I don't know what you were like with your children, but the hormones that we
Oh yeah,
experience.
for sure. Yeah. Waves, let's say
Yeah.
waves. I don't know what to call them. Surges, all kinds of stuff of emotions. Absolutely. Yes. How did you get into, well, let me ask this a different way, actually. We're going to backtrack here. You said that you have a complex PTSD program. And
Right.
when I was researching you a little bit, I did see that and I was like, oh, that's really interesting. So, how did you develop that program? And can you tell our listeners a little bit about it? Is it in person? Is it online? Is it something they can contact
It's
you about? Like,
it's online and it's face to face as well.
okay.
How did I go into this? It was probably a lot of things I do was because of my sister.
Uh-huh.
And it was dealing with in 2016, my dad had a really big stroke, and then later on that year he did pass away,
Mm.
and I was already showing symptoms of acute PTSD,
Mhm.
and that's when I got kind of more interested in it. And when my sister went through a really tough time, she had cancer 6 times, so each time
Whoa.
it was
Wow.
surgery and treatment and therapy.
Yeah.
And then I met this lady in a group, and she was doing it for the military.
Mhm.
This lady had been a war correspondent for 30 years on the front line. She's a journalist and come away to start working with military men. So we trained with her because of the military. And for a while, I did start working with these men and then realizing that there was no support for them.
Mhm.
once they leave. And I can think of one person in particular, and I mean, tracing back their ex-military psychs, it really was a lonely place for me. And I did have my supervision with this lady, Sarah Ewan, her name is. And I realised didn't think it was for me, because when you're taking on that type of client, you've got a few of them, it burns you out. And that's when I started becoming burnt out. But what I realised, Liz, was that people were displaying these symptoms in all my clients. So I started to put this program into physical ailments, anxiety, and getting the most wonderful results with it. And a lot of it was content free. Although there is regression involved in it, there is a lot of, it's very content free. You leave the person to deal. And I really loved that, because you know you're guiding your client. You're not suggesting anything to them. You're just telling them to go in and meet that part of you. Which was so lovely. And that's what I continue doing. And because it gets so much success, and it is a 6-week program, so people are not coming in and having one session and wandering off, because I believe that can be dangerous, to open a box of worms and then not continue it through. So they know they're signing up for 6 weeks, and they know we're going to take that through, whether it's one session every fortnight. You know, they can go along at their own pace as well. And that's when since September 2022, I've been working very much in that way. Now, Sarah Ewan has now actually set up a website called catch.com, which is Crisis and Trauma with Clinical Hypnotherapy. And it's pure hypnosis, pure hypnosis. And Sarah's not a fan of EMDR. I believe the military have dropped EMDR now, because people used to say to me that would come from having it done in the National Health Service here, that it over-traumatized them.
Yes, I've heard that as well.
You have, yeah. I'm yet to find any, what can I put it? Any scientific research that makes sense to me as why that happens. The research points to it being, I like to call it like a traffic jam, clearing, like a traffic jam from the prefrontal cortex to the amygdala to the limbic system. And because that's so clogged with all these emotions that we haven't dealt with, the signals can't get through properly. So once that is cleared, then we are thinking more clearer. I've only ever seen the positive side. I've never seen any negativity with it personally. But with this guy, it is, when you work this way with Sarah, she is very clear that you do this program as it was set out. You just follow the process, really. So that's where I kind of stayed, really. And I think when people have come in for therapy, again, the lines between counselling and hypnotherapy is still very blurred here. Yeah, it's not a talking therapy hypnosis. So, and what I found, it was getting so many great results, and it was almost like handing the power back to people. They were making up, the advice was coming from themselves, not someone telling them. So they're learning to listen to themselves. They're learning to trust themselves. And they're learning to recognize the signals, because hypnotherapy is the last port of call.
Is the last what?
Yeah, port of call. They've probably been everywhere looking for answers.
Yes, yes, often it is, right? It's the last thing they're going to try.
And yeah, and because the NHS in the UK will support EMDR, and I think they've dropped acupuncture. I'm not sure. People will go to what the NHS tells them to go for. Okay. And EMDR here has got a 4-year waiting list for it.
Whoa.
4-year waiting list. So
does the NHS, do they cover clinical hypnotherapy? Oh, they do. Okay. All right.
They cover the therapy for them. But again, it's a 4-year waiting list.
For the EMDR, but not for hypnotherapy.
Hypnotherapy is not covered. Sorry to confuse you all. Sorry.
Okay.
Hypnotherapy is not even on the NHS. It's not even coming into question.
Okay.
And that they wouldn't work. They don't work with it. And some people who come to me say their doctors tell them that it's dangerous not to do it.
Oh, geez.
Even today,
Yeah.
I have had referrals for hypnotherapy from oncologists and neurologists in the local hospitals, doctors' surgeries, particularly if the staff have come and they've quit smoking or done something quite superficial. They'll get in touch. They'll send their patients, But that is very far and few between. Okay.
The CPTSD program. So you're meeting online, but you said it's also in person. So at what point do they come in person?
At what point? When they've probably exhausted every single option, they're no longer able to work.
No, like in your program, you're saying.
Oh, at what point do they come into the program? Is from session 1, you mean? Yes.
Oh, yes. Is that it? Like walk me through it. You're seeing them in person for 6 sessions.
Yes.
But there's also an online component to it.
Yes, they can either choose to work online, like I'm talking to you now, or they can come face to face.
Oh,
The
okay.
majority,
Okay. So someone from around the world could choose to work with you
yeah.
online. That's what I'm trying to get to.
Oh, I'm sorry. Yes, yes. So you can work with me anywhere. If you're not in
Okay. Got
Swansea,
it. Got it. All right.
we do exactly the same thing online as what we do in person. I prefer online. I don't know about you, because the person sitting in front of you,
Mhm.
they tend to be more relaxed because they're not coming in, they're not nervous. A lot of people who come to me are quite nervous when they start,
That's true.
which is understandable. I've been in that position myself.
Mhm.
So they're normally in their pajamas or in their tracksuits. They don't have to go anywhere, they're in their
Yeah.
home, and it's really comfortable. And they know after the therapy, because I do a lot of my online work in the evening, they
Uh-huh.
can just toddle off to bed and relax and just,
That's true. That's a lovely way to see it. I mean, I do love in person. I really do. I work online all over the
mm,
world, but there's something about in person for me that really resonates as well.
yeah,
Yeah.
yeah. I think after COVID, people just want to get out, don't they? They just don't want to be stuck in online. They've been working online for so many years, and or they may still be working online from home, and they just want to come out.
That's true too. Yeah.
Or if the issue is something to do with their home life, they want to come out because,
Yes. Yes, like sometimes even they have a private office and they're there, there is a different feeling of privacy. Even
mm,
knowing someone's in the house who, I don't know, could hear you is a different state. Right? Than like you're in a private office and nobody's around, just you two. So yeah,
exactly.
that's an issue sometimes. Mhm.
Yeah, it is. And it's kind of more official when they go in somewhere as well, isn't it?
Yeah,
So
that's true too. Yeah, there's a different
that
process
kind of,
to it, but I love your viewpoint on it. Like they are cozy and they're in the pajamas. If you're in the evening, I work mostly during the day, but still there's a comfort of like, oh, I can just go make myself a cup of tea and I'm done and return to my
yeah.
routine or do something calming. Like absolutely. Yeah, or go to sleep if it's in the evening. Yeah.
Yeah. And some people come to see me face to face, and once they've met me,
Uh-huh.
they might say, "Oh, can we carry on doing this online?"
Yeah,
Now
I
I'm like,
have that too. Uh-huh.
you know, and if we've done a consultation on video call, sometimes they'll be like, "Oh no, I'm just doing on video, it's fine," because they've done the consultation, they've met me. Because it's really important, isn't it, that people, when they're going to be sharing their utmost vulnerabilities with you, that they've kind of gel with you and vibe with you as well. And that's why I say to people, come on video first if you're comfortable, and we'll do it that way. And always by doing that, they can see what type of person you are as well. So
It's
yeah, so
very true. Yes. All right. So then you work with them for the 6 weeks, and it sounds like you're getting really good results, is what I'm
yeah.
hearing. Okay, and then do they have some follow-ups? Do you have a certain percentage that, needs a little extra? Like, what has that been like for you?
Actually, a good question. No, I can honestly say no.
Mm.
And my follow-up process is 1 month,
Uh-huh,
then I go 3 months, then 6 months, and then I tend to fade away.
uh-huh,
But oddly enough, a few months ago, I live in Wales, in Swansea, and I was traveling to London to meet a friend.
mhm,
And I got this message of, she's one of my first EMDR clients, actually. And she messaged me, and I'm trained in menopause as well, menopause coaching.
uh-huh,
And this is another thing I wanted to bring up is the resurgence of trauma during menopause due to the decline in hormones. You may see a lot of it yourself. And I was so grateful for this teachings, because before it, you just think the woman was anxious, you just think they were,
uh-huh,
but you could spot things a lot more than referring back to their doctors to
uh-huh.
get further blood tests. Anyway, I was sitting on this train, and I got this message going, and she's put this very public on my Google review, but thank you so much. You saved my life.
Aw.
And I'm like, no, your determination. And she went, by the way, I'm 4 stone lighter. She's lost weight. She's got this meditation studio now in her house, all her colours, and she's kind of back at
Mm,
work, and life is good for her. And it just makes me smile when I get those messages. And it's just thinking,
yes.
yeah,
Yeah,
it's lovely.
like the 4 stone wasn't even the goal really, but it's a
Yeah.
nice side effect. That's what I'm hearing. Like the
Yeah.
goal was really to feel to that complex PTSD is resolved.
You've got me thinking about that now. No, no one's ever come back. Can I put a feather there? No, you're right. So that's why I believe in being thorough, because if you're just doing one session or
Uh-huh.
two, not going through the complete process, you
Yes.
know, you've got to do it all. That's right. And I mean, and I'm speaking from experience
Yeah,
here. I did it.
yeah, hands down agree with you. I have a core healing program which we're looking at deeper beliefs and from childhood and rewriting those so that they're more productive, really healing negative beliefs. And I did it for a couple of years, and then I began to say, people will want to start it and they'll think like, oh, I'll just do 1 or 2 sessions and that'll be enough because money or this or that or whatever. And I begin to say to people, do not start this unless you can do, actually it's 5 to 6 sessions is what it is. So until you can do 5 to 6 sessions, save your money, take your time. I'm not going away. I'm not going anywhere. Like until you can really commit to 5 to 6 sessions, like don't start it because there's a risk there if you start it and like cut it off too soon. Like you're saying, like for some people, EMDR, they felt re-traumatized sometimes by that. So I don't believe I'm re-traumatizing people, but it just feels like unfinished for them.
Yeah. And, this is a big, big topic in the hypnosis world. It certainly was in one of our groups on Friday. And I'm blessed to have the most amazing teachers I've trained with. And one in particular is a lady called Wendy Weber. And
I know Wendy Weber.
Oh, well, she's amazing.
I took several of her courses. She has online courses. I love her. Love her. Yeah.
When you come up with something during her training, I don't know if you caught this, and it's like when we have a subconscious issue, it was first a conscious issue.
Yes.
And all that is carried around inside us, hence we have the behavior problems, the actions that we take. It's like a little volcano waiting to erupt if it's not dealt with. So when we look at regress to cause, there's another guy called Daniel Garner. We look at revivification. When we're not really reliving it, it's there within us anyway. So when these people say, oh, they're being re-traumatized, they're not, because it's in them anyway.
Yes.
We're bringing it out for release, whether that's content free, whether it's whatever, it's coming out. So it's no longer there. Then we have that clear pathway between the parts of the brain. We are thinking clearer.
Yes.
We're not in that freeze mode any longer.
Yes.
We're not in that circle of hypervigilance. We are breaking free from that. And last year, I developed something called really loud tinnitus. Tinnitus for the UK listeners, tinnitus for the American. And it drove me to the point, it was insanity. It was awful. And it was so loud, some parts I couldn't hear anything but it. So I went into this massive trauma response to it. And one of the ladies from the CPTSD group, she's an ex-psychiatric nurse, and she went, Jackie, I'll work with you.
Uh-huh.
Her name was Heather McRobinson. And we spent, we had 8 weeks through it. After 2 weeks, I was ready to go back to work.
Oh, yeah.
Just hypnosis only.
Yes.
Right?
Yeah. I work with tinnitus, but I stopped working with it because every time I have a tinnitus client, and usually they're local referrals for me, not many online, mine will come back. And it'll just like, when I'm done with the client, it'll like fade away, completely away. So I'm like, okay, this is a clear sign that I should stop doing this work. Like really.
That's a good point, because people on, I don't know if you've went to the route of following, well, he's from America, Dr. Ben something, Thompson, anyway, I was obsessed with him at first, thinking, I need to get rid of this. I spent thousands of pounds on therapy, trying to get rid of it. And my sister, thankfully, has come through her cancer journey. She's now doing a Reiki practitioner now.
Okay.
So, and her tinnitus never bothers her because she had bigger things to worry about.
Yes.
But when she treats people when the energy frequencies come in, she just comes screaming back until they're gone. It's really odd, isn't it? So
it's really funny. I always think it's so funny how the mind and the brain works. So even when mine comes back, when it did come back, when I was working with someone, I would, I just tell myself, like, let's listen to something else. Right. Like there's lots of sounds around here for me to tune into. And so I would gently talk myself through it. But yeah, it's like, no, thanks. When a referral comes my way now, thanks, I'm good.
And that's what it's on Ben's channel. Say, hi, just dropping by. I won't be back, but just to say, you will get through this. And I don't come on email because I've dealt with mine now. I don't want to talk about it any longer.
Yes.
And people are like, where are these people who recovered, and negativity, you'll never recover, you'll never get over it. And because they don't come back in once they've dealt with it.
Oh, yeah. Mm-hmm.
Because it's like you don't want to be reminded, and even though my sister my sister has this amazing journey of cancer recovery. Mm-hmm. She's like, I don't want to work with it anymore because I just want to get on now.
Yes.
That was then what I've taken from. I'm learning. I'm doing it, the preventative stuff, So yeah, interested.
Yeah, there is definitely a debate in the the hypnosis field. Like, I think sometimes that is the case. But I have gotten the cases where it's like they dropped out really early. So let's say they did 1 or 2 sessions and then they contact me later, or, something happened and it's like, yeah, like I tried to tell you, like you need to complete this work. It didn't feel complete to me. I mean, there's plenty of things I do in 1 session or 2 sessions. Sleep is 3 sessions often. That's it. That's all they need. Or stop smoking. I could often do 1 session because my success rate is so high on 1 session. They don't need more. But I think there is a feeling sometimes of, okay, this is done. This is complete for this person, even though it's not 5 or 6 sessions or whatever it is. And then other times it's this feeling of this isn't. I think my caution to people is like, make sure you can have the time, the energy, the space, and the money to afford the 5 to 6 sessions. Like, don't cut out early because of these other factors. If you don't need it, totally fine. Yeah, you're done. You feel like it's cleared.
Yeah, exactly. No, I'm just having interest, and I noted over the last few years, and I brought this up in my group, the PTSD group, was
Yeah.
that men, no disrespect women, I love women, I'm a woman myself, but men seem to commit and whiz to it, whereas women will be like, oh, I can't quite make today, and I found that not all women, but I found that men are the more committed.
Either way
My
for me.
experience,
Yeah.
when the program was put together, there was I think when Sarah was doing all the cases, they were all men she was working with.
Uh-huh.
So I don't know. That's an interesting part. The men's go see the course more than women, I have found.
Interesting.
Which
Okay.
makes me think women, we do feel guilty, don't we, with spending on ourselves or putting ourselves
We
first,
do
or
sometimes,
when things
yes.
fast, it's like, oh no, the children need this and I need that, and I
Yeah.
can't go taking 2 hours out of my day. I've got things to do, and yeah.
For sure. I remember reading a study, this was years ago, that women will take their spending money, their extra money, and spend it on their children,
Yeah,
and
I
men
bet.
will spend it on themselves.
Yeah,
And that always struck me of like, oh, you see that play out though, in terms of something that a woman needs. Of
yeah,
like, no, you really need to spend this on yourself, often to benefit your children that are there or your loved ones in the environment. Like, the more you can do that work, it's going to benefit them. And
yeah.
when we frame it that way, when we think of it that way, it makes it a little bit easier for us to do sometimes.
You were saying that now. My children are now, one's nearly 17 and one's nearly 18.
Uh-huh.
And I have this friend in Liverpool. She's really glamorous, and she says to me, go and pay and do your hair. Go and get your nails done. I'm like, I know, I could never spend that much money on myself. It's crazy. Now I do. Get it done now because I don't feel so bad now. My daughter's going, Mum, I love your nails. They look so incredible. I'm
Aw.
going, oh, thank you. Whereas in the past, you'd be like, I couldn't possibly spend that on me. So women, yeah, we do tend to like not give to ourselves when we got children. We put them first, don't we?
We do. We do. Yes. Great. Well, we're coming to the end of our time here. It has been absolutely delightful to talk with you and get your perspective. Please tell people how to find you if they want to work with you.
Okay, I have a website and it's called www.jsh hypnosis.com. All my contacts to my WhatsApp, my email are all there. I prefer WhatsApp because the majority of us are on WhatsApp at the minute because I see those messages straight away. An
Uh-huh.
email could take 4 days to get to me, or connect to my Facebook website as well. So a lot of people come through my Facebook as well, but more than ever WhatsApp because on my WhatsApp I have a business catalogue.
So what is your WhatsApp handle?
It's +44
Mhm.
7368 919 833. I'll repeat that. So it's +44 7368 919 833. And
Okay.
on there, I have a business catalogue with all the programs I work with. Over the years, I have niched a lot in fertility. I think hypnotherapy for fertility is
Mhm.
amazing. And all the other stuff I do, all the regular stuff we do as hypnotherapists, but everything's
Yeah.
on there and it connects then to my website.
Oh, fantastic.
So it's
Can
all
you
connected.
spell your website name for us as well?
Yeah. So I got a bit of a list of them. So it's JSH. My name is Jacquelyn Suzanne Haley. So JSH hyphen hypnosis. That's HYPNOISI.
All right. And
Dot
all
com.
of those will be in the show notes as well. So
Yeah. Thank you
if
so much.
yeah, it's not everyone's like auditory. And so,
That's
I
true.
always like to have it written out for people so it's easily, they can click on it or they
Yeah.
have that number. They're not scrambling in the car to write down that number. It is in the show
Yeah.
notes.
That's
So
true.
whatever
That's true.
app you're on, if you even sometimes all the apps don't show the show notes. I was on this one the other day and I was like, where are the show notes? But it's always on my website. So
I
if
saw
you,
yours when I went on your website. I saw your number and everything come up. Yes, it was lovely. Yeah.
yeah, like every show note for every podcast episode I've ever done is on my website. So you could always search it up. Jacquelyn Haley.
That's kind of you. Thank you so
Yeah.
much for your work. It's wonderful.
Yeah. Yeah. Yours as well. So again, thank you for being here and have a wonderful day.
Thank you. Thank you, Liz. Thank you.
I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, DRLIZ hypnosis.com. I work all over the world doing hypnosis. So if you're interested in working with me, please schedule a free consultation over at my website and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace. This podcast is not mental health treatment, nor should it replace mental health treatment. If you need therapy or hypnotherapy, please seek treatment from a trained professional.